So Alzheimer's disease. Alzheimer's disease is a slowly progressing disease of the brain, and currently 150 to 200,000 Australians are living with the condition at the moment. So the main risk factor is increasing age, and since Australia's population is an ageing population, the amount of people living with Alzheimer's disease each year is growing. So the disease is a slowly progressing disease and involves damage to the brain cells, where initially it damages the part of the brain responsible for forming new memories. So things from even days or hours ago now become difficult for these people to remember. So as the disease progresses, more complications arise, and these patients suddenly lose the ability to make logical decisions, they lose the ability to make out simple words, they have a decline in the ability to perform simple tasks, and they have a decline in the ability to make sense of what they hear, smell, or even see. So for those people who are at high risk of developing Alzheimer's disease, we can perform a mini mental state examination, which is an exam that goes through a bunch of tasks for these patients to perform, and at the end of this exam they get a score that adds up from all these tasks, and based on this we can determine whether or not they are at higher risk of developing Alzheimer's disease. For those people who are at higher risk, we refer them on to the doctor to confirm whether or not they do have Alzheimer's disease. So to go along with the medications that doctors may prescribe, there are some strategies we can employ to help manage living with Alzheimer's disease. So the first initial step after being diagnosed is to let your carers or those around you know that you have been diagnosed with Alzheimer's disease. They can help by making the home environment more comfortable to live in, so this may be allowing room to sit and relax and space to perform hobbies that you may enjoy. They also may make the home more open and clean, so maybe removing unnecessary items around the house. They may have a whiteboard for daily reminders, and they may have anti-flooding devices installed in the kitchen and bathroom. There are also some resources for more information on Alzheimer's disease. So this includes the National Dementia Helpline, which is this number here. There are patient help sheets which can be found online, the Dementia Guide, which can also be found online, as well as NPS Medicines and Dementia, which is also online. You can also visit a local pharmacy to get more advice on how to manage living with Alzheimer's disease for either the patient living with Alzheimer's disease or their carers.